Good afternoon, everyone. Welcome to today's episode. In today's episode, we are going to introduce surgery and surgical nursing. So, with me, I have objectives that we are going to journey with to understand what surgery and surgical nursing is all about. So, by the end of the day, every student should know how to define surgery and surgical nursing, and we also need to describe the aims and importance of surgery. We also need to identify types of surgical procedures. We also need to discuss the laws of a surgical nurse. Okay. So to start with, allow me to bring to attention where surgery is driven from. So the word surgery is driven from a Greek word which means hands work or hands on. What this simply means is that meaning a surgical procedure has to involve your hands. Your hands should be involved in doing the certain procedure. Okay, so I believe each and everyone knows now where surgery is coming from. So per definition, surgery, this is a branch of medicine that deals with diagnosis, treatment, and management of diseases or injuries through operative procedures. So this surgery can be either elective, emergency, curative, palliative, or preventive. Okay, so we are going to move on to another objective that we have this afternoon, which says what is surgical nursing. So surgical nursing is nursing care given before, during, and after a surgical procedure. Before, during, and after a surgical procedure. So surgical nursing aims to improve the patient's safety, comfort, as well as recovery. It also includes palliative, preoperative, intraoperative, and postoperative phases. Okay. So what are the aims of surgery? So the aims of surgery, the reason why we are performing this surgery is that we want to remove a disease, one. We want to repair injury, two. We want to repair, we want to restore function, and we also want to improve appearance. So improving appearance, this is why people undergo plastic surgery. Then we also have another objective that we're going to look at this afternoon, types of surgery. So with me, I have 3 bullets that will describe types of surgery. So the first bullet that I have is surgery, type of surgery based on agency. Then the second one is based on purpose. Then the third one is based on extent. So under based on agents, we have 2 things that are involved. Surgery can either be elective or planned, or a surgery can be emergency. So what do I mean by elective or planned? So these are type of procedures that can be planned, that they will be done or performed on a later date. Then emergency, these are life-threatening conditions that do not have to wait, but they have to be performed on that actual day. Example I can give is hemorrhage. The patient just comes in bleeding, meaning you need to arrest that bleeding. Okay. Another one is based on purpose. So based on purpose, we are performing this surgery because we want to find a cure. We are performing this surgery for palliative. We are performing this surgery for prevention. We are also performing this surgery for diagnosis. So that is based on purpose. Then last but not the least, on types of surgery, we have based on extent. So based on extent, we've got 2 things that are involved. The surgery can be performed because of minor or major. Major simply means big, minor, small. Those are the 3 types of surgery that we have. We are also going to move on another objective, which is phases of surgical nursing. Phases of surgical nursing. Under phases of surgical nursing, we have 3 important bullets that we need to understand. Bear with me to say this is where questions under surgery will come from. It's either you are managing a patient before a patient goes into surgery, or you are managing a patient who is already on a theater table, or you are managing a patient that is from the surgery room. So phases of surgery, we have pre-operative phase. So pre-operative phase, this is the care that is given to a patient before they undergo a surgical procedure. So what are you doing in this pre-operative phase is that you as a surgical nurse, you are assisting the patient, you are also preparing the patient, then you are also giving a consent form, which is a legal document which gives a go ahead to a theater doctors to say, okay, the patient has accepted to undergo this procedure. Okay, then we have another phase which we are calling intraoperative phase. So intraoperative phase, this is a period in which the patient is in the theater room now. So this is a care that we are giving to a patient in the theater room. So as a surgical nurse, what are you doing there? You are assisting the surgical team. You are also ensuring to say there is sterility in the theater. You are also assisting the surgical team in preparation as well. So those are the things that we are doing in intraoperative phase as a surgical nurse. Then last but not the least, we have post-operative phase. So post-operative phase, this is the phase or the care that is given to a patient who has undergone a surgical procedure. As a surgical nurse, what are you doing there? You are monitoring vitals, you are managing pain, you are also doing your own care. Okay, those are the things that you are doing as a surgical nurse in the post-operative phase. Then we are moving on to yet another exciting objective, which we are calling laws of a surgical nurse. So as a registered nurse, you will be allocated to a theater ward. So it's very much important to know your duties or your laws so that you do not overlap or overdo things while you are located in a theater ward. So what are the laws of a surgical nurse? The first law is that you as a surgical nurse, you need to educate the patient and also support the patient. What do I mean by educating the patient? You will tell the patient to say, we are sending you to the theater room because you have such and a such condition and it can only be cured through surgery procedure. Then you support them to say, don't worry, all things will be just okay. We have a good and qualified surgical doctors. Okay, then the next procedure is that you are giving the next law of a surgical nurse is that you are doing assessment and also monitoring vitals. What do I mean by that? Monitoring vitals, you are doing your BP, your temperature, your pulse, and other things that fall in vitals. Why are you doing that? It's because when the patient has got high BP, they cannot be taken to the theater room, meaning you have to control the blood pressure. Then later on you send the patient to the theater room. Then the third objective, the third law of surgical nurse that we have is you as a surgical nurse that is allocated to a theater room, you have to ensure that infection prevention and aseptic techniques are followed. Effective prevention is that you need to sterilize all the equipment that are used. Aseptic techniques, we are just simply talking about the following of the ethical conduct or ethical laws that are supposed to be followed in the theater room. Examples like gloving, putting on a PPE, face mask, and also sterilizing the table. Okay. Another law of a surgical nurse is that you will assist the surgical team. You as a surgical nurse that is allocated to a surgical ward, you will be assisting the surgical team in preparing, giving them equipment that are supposed to be used on the theater table, giving them enough light, and also, okay, those are the things that you need to do. Last but not the least is that documentation and communication. So what are you documenting? You are documenting the vital signs that you found or your findings in the patient after and before, and also the progression or maybe the finding in the surgery. Then later on you will communicate your findings to the person that is allocated to that ward. In this case, we have the in charge of the ward manager. So those are the roles of a surgical nurse. So in conclusion, surgery is a very vital part in healthcare, and surgery also plays a very critical role in the patient's outcome, and it also emphasizes on the patient's safety, comfort, and also recovery. So those are the things that we need to pay particular attention in surgery. Then last but not the least, do you have any questions based on what we've discussed today? If there is no question, please feel free to follow us on our YouTube channel, which is Nurses Diary. Link, and also comment, like, and share. Link will be sent in our comment section. Thank you very much for paying attention.